Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Celecoxib with a brand name of Celebrex. Although there are many indications, we typically see this medication used most commonly for pain, and it's classified as an NSAID, or a non-steroidal anti-inflammatory drug. Before we get into the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source of recommendations for your personal health care. So Celebrex is indicated for the relief of symptoms associated with a couple different conditions. One of the main ones that we see it used for is osteoarthritis. We do also see it used in adult rheumatoid arthritis, as well as spondylitis. It can be used to treat musculoskeletal or tissue trauma, such as sprains. It can be used to treat pain following an orthopedic procedure, as well as after dental extraction. It's important to note that for these conditions, it's only treating symptoms and not halting any disease progression. Now, before somebody was given this medication, there are some contraindications that must be considered. It cannot be given after a surgery involving a coronary artery bypass graft. It should be avoided in the third trimester of pregnancy because it causes premature closure of the ductus arteriosus. Breastfeeding infants can have some serious adverse reactions from this medication, so it's typically not used during breastfeeding as well. It's avoided in severe uncontrolled heart failure. Some people will avoid this medication when they have severe reactions to sulfonamides, as there can sometimes be a cross-sensitivity. People who have had allergic reactions after taking ASA or other NSAIDs may want to avoid this medication. If somebody has an active GI ulcer or gastrointestinal bleed, they should avoid taking this medication as well. It should be avoided in situations where there's cerebrovascular bleeding. People who have inflammatory bowel disease avoid this medication. We also try to avoid giving this medication to people who have severe liver impairment or severe kidney impairment. With the kidney impairment, that would be a creatinine clearance less than 30 mL per minute. Finally, we avoid giving this medication to people who have a known hyperkalemia or a high potassium level. In terms of warning and precautions, there is a warning with this medication regarding cardiovascular disease. I don't want to get too into this warning as there is a lot to go over with it. However, I will say that if you are somebody that has cardiovascular disease and you're starting on a long-term non-steroidal anti-inflammatory medication, just have a discussion with your physician or pharmacist, as there are certain medications in this class that are better suited for people that have cardiovascular disease. So after somebody is made aware of all the precautions and the contraindications and they start using the medication, it's typically taken in capsule form, available as a 100 and a 200 milligram capsule. When somebody's using this medication for osteoarthritis, we would typically see 200 milligrams taken once daily or 100 milligrams taken twice daily. With rheumatoid arthritis, 100 milligrams twice daily is common. However, in this situation, the dose can be increased to 200 milligrams twice daily. When somebody's using Celebrex to manage acute pain, there are different dosing strategies that can be used. I've seen a strategy where somebody uses 400 milligrams for the first dose, and then 200 milligrams once daily thereafter for 7 days. In all situations, the medication can be taken with or without food. However, with all NSAIDs, we always caution people that if they notice any stomach upset after taking the medication, they may want to have some food in their stomach before they take their next dose. Now, as with all medications, there are some adverse reactions or side effects that people may experience while using this medication. So I'll list some of those side effects here for you now. Abdominal pain, dyspepsia, and diarrhea are all common, coming in between 4 and 9%. Flatulence and nausea come in at about 3%. Back pain and peripheral edema happen in about 3% of people. Dizziness happens 2% of the time. And headache, which is one of the more common side effects, can happen in about 15% of people. Insomnia can happen, but it's not too common. Only about 2% of people experience this. 5% of people notice that they develop sinusitis. And 8% of people develop an upper respiratory tract infection. About 2% of people experience a rash. That's all I'm going to talk about today with Celebrex. As always, I'm happy you took the time to stop by and watch one of my videos. If you thought the information was valuable and you'd like to help me grow the channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also a couple links in the description you can check out as well. That's it for today. Take care.